5 cardinal signs of acute inflammation. So when I see these cardinal signs, I know that this is acute inflammation. So the first cardinal signs of acute inflammation is what we call rubor, which is redness. So redness is the first sign of acute inflammation. And what's causing this redness? So for instance, let's say this is the blood vessel, right? And as you know, the blood vessel is lined by what? We're going to have our endothelial cells, right? Endothelial cells. So, and let's imagine that there is an injury or there's an infection, there's a bacterial infection in the tissue, right? So, with the first one, which is going to be our vasodilation. So, the release of histamine, nitric oxide, prostaglandin. So, this is going to cause vasodilation, so to dilate the blood vessel. And as we know, with vasodilation is going to lead to decrease in what? Decrease resistance to the flow of blood, right? So the resistance to the flow of blood is going to decrease, and that will lead to what? Increase blood flow, guys. And then because of the increase in blood flow to that area, what's that going to lead to? So that will lead to redness. So that will make that area to be red. And then this arteriolar vasodilation is mediated by histamine that is released from the mast cell. Also nitric oxide that can also be produced from these endothelial cells. And then lastly, prostaglandin that could be released from the cell membrane. Remember, the prostaglandin is produced from the arachidonic pathway. And then moving on to the next one. So the next one there is going to be calor, which is heat. So with what we just mentioned earlier, so with vasodilation and an increase in blood flow, so as blood is moving towards the site of injury or where the bacteria is, what happens? The heat is also moving to that area. And of course, increase in metabolism in that area as those cells are wrapping up their metabolism, that will also lead to production of heat. So the calor is due to increased blood flow plus increased local metabolism. And this is also mediated by histamine and a prostaglandin, particularly prostaglandin E2. The next one there is swelling, which is what we call tumor. And this swelling is due to increase post-capillary venous, guys. You have to remember that location is iode. Post-capillary venous vascular permeability. So, which could be due to contraction of the endothelial cell. So, once you contract or destroy the endothelial cell, or what we call permeability of the capillary, post-venous capillary. So, what's going to happen as a result of that is that those leukocytes inside the blood vessel, they will start to move out of the blood vessel, which is what we call leukocyte extravasation. And as they're moving out, all those plasma protein in the blood vessel, those plasma protein will start to what? They will start to move out of the blood vessel. So they move into the interstitial space. And too much of fluid in the interstitial space is what we call edema, swelling, right? So that will lead to swelling. So as we can see there, so increased post-capillary venous vascular permeability, that leads to plasma leakage, which is what we call exudate, because exudate is a fluid that has a lot of cells and a lot of protein in it. And that will lead to leakage into the interstitial space. And that leads to increased interstitial oncotic pressure. Remember, oncotic pressure is determined by the protein. And what are the key mediators here? So one is histamine. 2 is bradykinin. 3 is leukotrienes that is produced from the arachidonic pathway. So we have leukotriene LTC4, LTD4, LTE4. And the last one there is platelet activating factor. The next cardinal sign of inflammation is dolor, which is pain. So, and what's causing this is sensitization of the nerve endings. And these key mediators here include things like bradykinin, which is the major pain mediator. We have prostaglandin E2, and we have substance P. And these are the key chemical mediators for pain. And then the last one is loss of function. So everything we talk about since, so the pain, the swelling, and the tissue damage, all this could lead to loss of function. So the first question there, a patient with acute appendicitis complains of severe localized pain. Which mediator most directly responsible for stimulating the nociceptor at the site of inflammation? So the best answer there will be very good, bradykinin. Remember, we said that bradykinin and prostaglandin E2, both of them are what mediates pain. The next one there is a 7-year-old child presents with swollen, warm, erythematous knee after a trauma. Joint aspiration reveals protein-rich fluid. Remember, we said that protein-rich fluid are what? Are exudates. What is the primary mechanism responsible for this swelling? So like we mentioned earlier, release of histamine is going to cause endothelial contraction. And by causing endothelial contraction, that opens the space between the endothelia, and that allow those protein-rich fluid and the leukocyte to leave the blood vessel to go to the site of injury. So the best answer there would be endothelial contraction. Next question. Which mediator contributes to both pain and fever during acute inflammation? Remember, we are not only referring to pain here, we also make asking about fever. So the best one there is going to be prostaglandin E2. Remember, as opposed to bradykinin only contribute to pain, not fever. But prostaglandin E2 contribute to both pain and fever. And remember, prostaglandin E2 is produced from the arachidonic pathway. And that's why if somebody is having fever or pain, what do we give? We give NSAID, right? Like ibuprofen.